Hi, I'm Dr. Danielle from Dairy Side Veterinary Service. I originally grew up in Williamsburg, so I'm like 5 minutes from the home farm I grew up on. I have now been a veterinarian at Dairy Side for a year and a half. Still love my job every day. So, first, I'll kind of get into a little bit of what my everyday looks like as a large animal veterinarian. We'll get into a little bit of reproductive health and fun things like that. And then behind you, you'll see there's fun jars. We'll wrap up with that at the end. If you have any questions, just feel free to shout it out. Let me know. Based on the last group, we run a little bit tight on time here. So if you have questions, please just let me know as we go along. So as far as my day-to-day goes, I usually start every morning with a herd check, meaning I go out to a dairy farm similar to this one, and I'm checking those cows for whether or not they are pregnant, and if they're not pregnant, what structures are on the ovaries to kind of help the farmer get a better game plan of how we're going to go about getting this cow pregnant. Because at the end of the day, dairy cows need to be lactating in order to make the farmer money on a dairy farm. And ideally, to keep producing milk, they need to be having a calf. Hopefully one calf every year. That way they can continue to lactate and be a productive member of the dairy farm. In addition to herd health, which we'll come back to the herd checks, herd health thing as we head into that section of the room. But in addition to herd checks, after that, it's kind of fair game as to whatever calls in the office as to what I get into. Some days I'll get into some surgeries. Our most common surgery is a twisted stomach or displaced abomasum surgery in dairy cattle. A lot of times it happens just because they're not eating for whatever reason, whether they didn't quite pass their placenta, whether they have pneumonia. They could have a multitude of different reasons why they didn't want to eat. I have here my surgery tray. So as you can see, there's lots of things in here that I use for that surgery. I have a surgery pack that we had sterilized in the office. Has some instruments in there that I need to use, some gauze, some needles. Pretty much anything I need to get that surgery done is in that pack. I have a surgery gown that I wear. There's some sterile sleeves, some sterile gloves in here as well. There's some hobbles to keep everybody safe, because part of my job as a veterinarian, I still have to talk to people, newsflash guys, I still have to talk to people as a veterinarian. So I want to make sure that everyone that I'm working with stays nice and safe. That's part of my job. So there's also some suture here that I utilize for the surgery. There's some lidocaine that we use. A lot of times these cows will stand for the whole surgery and they'll do just fine with just some lidocaine. They want to get a little bit uncooperative during the surgery. Sometimes I have to utilize some sedation just to calm them down a little bit. But most of the time, just some lidocaine and they'll stand the whole surgery. It's pretty straightforward from there. Other times they'll get called out on calvings, or we're heading into the winter season where it's lambing and kidding season. So we'll get into some of those here shortly. But for calving, a lot of times I'll utilize some J-Lube to help lubricate things, keep things nice and slick, to help keep the calves moving along as we need them to. A lot of times I'll utilize my OB chains and the handles to help bring the calf along with some assistance. And then this fun tool, I don't even know if it has a name for it, but you can pass one of these chains through here and utilize this tool to, you can kind of bend it and fold it as you need to, and you can pass it around a leg or around the calf's neck if you need a little bit of extra arm's width to kind of get the chain where you need to go to help get the calf in the correct position. Of course, I use my stethoscope a lot. We see a lot of sick cows, so stethoscope is absolutely a must. I don't have my thermometer here, but that's also a must. I have multiple of those in my car. So if they get left somewhere, we're okay. Going back to the herd check side of things, pretty well that entails me wearing either these Pellas, or I have some waterproof udder techs that I put on. I'll put on a breeding sleeve, hold that down with the hemostat. And a lot of times I can use my hands to kind of check the uterus and the ovaries and see what's on them, but we also utilize ultrasound. Ultrasound is great, especially for the amount of information it can give us. So whenever I go in, I can say the cow is pregnant. If I'm just using my hand, I can say, yes, she's pregnant. I might be able to say if the membranes are a little bit loose or something feels a little bit off. But with the ultrasound, I can go in and say, okay, I see a good heartbeat on that calf. Or I can tell the farmer, hey, the fluid in this around this calf looks a little bit cloudy. Let's watch this cow. There might be a problem that's trying to brew, and kind of keeps the farmer attuned to the fact that there may be something going on with her. So we've got a nice reproductive tract here. We have the vulva, heads down into the vagina. The cervix is right here, leads into the very short uterine body that cattle have. There's 2 uterine horns. Then at the end of the uterine horn, there's ovaries. Now, I think this ovary on this side didn't make it in the whole dissection process, but we have the fun ovary on the left here. And if you see here, this structure that's pretty clear looking right on the edge of the ovary, that is a follicle. So what I'm going to have you guys do is I'll turn the ultrasound on here. Unfortunately, there's not a screen on this ultrasound, but I'll have you guys look through the goggles and I'll scan over top of that follicle so you can see what a follicle looks like on ultrasound. It'll be this little black dot, might have a little bit of cloudiness, white cloudiness in there, but it'll essentially be a little black dot right at the top of your screen. So whoever wants to start can come look into the screen. All right, this will be right at the top. You don't have to put it on, you can just hold the goggles right up to your eyes. See that black dot right at the top? Yeah. Yep, that's the follicle. So whenever I'm scanning the uterus with the ultrasound, that's what I'm looking for. At least one of the structures that I'm looking for. Whoever's next. Right in the middle. Yeah? Yeah. Okay. Black structure right in the middle. That's the follicle. Black structure right in the center. Black structure right in the middle of the screen. That's the follicle. So the follicle is what is essentially going to be ovulated off when the cow gets bred. The egg that's released from that follicle is what will get fertilized. So the fact that there's a follicle here means that this pretty big follicle too, this cow is probably coming into heat here shortly. So that's an important structure that we look for. Right in the middle at the top. Mm-hmm. A little cloudy, probably because it got frozen. But, all right, if we have time, I'll let you guys come back and feel around the uterus if you want to with some gloves. But we'll keep things moving. We'll head over to here. I know, it's a very confusing room. So they had asked me when I came here if I could talk a little bit about reproduction. So we talked about kind of the repro tract, how you look for its health, what things look like on the ultrasound. Like I said, the follicle will ovulate off an egg. That egg will become fertilized. One of the veterinarians that's here, Dr. Barry England, he's currently up in Toronto this week, but he is normally here on the farm day in and day out. Dairy side has kind of a relationship with the family and the farm here, so we do come in here for some things, but Dr. England focuses a lot on embryo transfer here. Essentially what that entails is a lot of what we talked about over there, seeing what structures are on the ovaries, getting the cows bred, getting the cows pregnant. For the embryo transfer part of things, they will go into these cows once they are 7 to 8 days pregnant with these embryos. They'll utilize this cup and this filter system and collect those embryos. They'll put them in those straws, and then the straws will get frozen in liquid nitrogen. And the reason that we go about doing some of this, sometimes we have cows that are really hard to get pregnant for whatever reason. Sometimes we know, sometimes we don't. Maybe the cow's a little bit older. Or if there's an animal on the farm that has really, really good genetics and they want to have a lot of those genetics on the farm that they can pass down, embryo transfer is a great way to get more than one calf from that particular cow every year, as opposed to if you would just get that one cow pregnant every year, you would get one, if there happens to be twins, maybe 2 calves a year. So it's a way to get more genetics into a herd faster than just your normal one calf a year pregnancy. Whenever those straws from the embryos get thawed, they'll then utilize this gun and these rods and go ahead and implant those embryos into the uterus. They'll wait a couple of days and then they'll go back in. Hopefully those embryos result in a pregnancy in that animal. Then in another almost 9 months, you'll have a calf on the ground. So in this microscope, we have, making sure they're still here, there's 2 embryos in there. So if you guys want to kind of quick shuffle through, they're going to be really, really tiny on your screen, really small, about that big. But there's 2 of them on the screen, so you know what an embryo looks like. Again, 7 to 8 days old. You will not be able to see it. If you look at the plate, you won't be able to see them with just your naked eye. You have to use a microscope at this stage. So they're super duper tiny. But that's what a calf starts out as, and honestly, that's what all of you looked like whenever you were first starting to grow into who you are now. Everybody was that small. It's not until they get a little bit older do they start looking like a calf or a goat or a lamb. So embryo transfer is one of the things as a veterinarian you can get into. It's more of a specialized field. So there's one of our vets, Dr. Jen, in our practice that does a little bit of embryo transfer. But it's certainly something that some people make as a whole career for themselves. So there's lots of different avenues that you can go into in veterinary medicine, not just what I do every day as a general practitioner. We'll start, I'll head in this corner here where you guys have a good view of everything. So we'll start over with these 3 jars, just because we talked about the embryo and calves are growing and developing. We'll start with this jar. This calf is probably about 40 days old. So that embryo that you saw over there was 6 or 7 days old. If you want to pass the jar around, please don't drop it, but that's what a 40-day-old calf looks like. A lot of times if a cow's going to abort a calf that early, we're not going to find the calf. It's pretty small. You've got to be at the right place at the right time to maybe find it. So, but you can tell from the little tiny embryo, now it actually kind of looks like a calf. It's starting to grow and develop into the animal it's going to be. We'll start passing this jar around next. This calf is probably about 90 days old. So you can see in 50 days' time how quickly that calf is starting to grow. That calf looks like a bull calf from the looks of it. Whenever they're as tiny as that 40-day-old calf, you're not really going to be able to tell super easily what the gender is. Usually you can figure that out with the ultrasound somewhere between 55 and 70 days. We'll leave this jar on the table. This one's a pretty big jar, but this is a goat kid that's probably pretty close to full term by the looks of it. It's got some hair. It's pretty close. But you can tell there's definitely a lot of growth from when it gets to 90 days. Goat kids usually their gestation's about 150 days, thereabouts. So there's definitely a lot of growing in a short amount of time for these guys. Even in the calves, you'll see, I'm sure, a lot of newborn calves around here too. There's a lot of growth that happens in those 9 months. Every once in a great while, so you'll walk around here, you'll see a lot of healthy calves. There's plenty of pregnancies that go on just fine around here. Calves are born, they're normal, they're healthy, they're doing great. Every once in a while, we'll have a calf that's born with what we call a congenital defect, meaning something didn't quite develop quite right while it was growing in the uterus. So this calf, this is a heart from a 12-day-old calf, and it has the congenital defect that we call tetralogy of Fallot. There's essentially, it's a fancy term, there's essentially 4 things that went wrong with the heart in development. So the blood, it wasn't able to get from the heart to be oxygenated into the lungs and then come back into the heart so it could go to the rest of the body. A lot of times, this is a pretty severe congenital defect, and so a lot of times the calves will not live for very long with that kind of a congenital defect. But we do see that every once in a great while. So if you want to take a peek at that jar later, that one's a big one we'll leave up here. Sometimes with sick animals, we'll look at neurologic issues, so we'll have to look at the brain. Sometimes if we're testing for rabies, we have to send the brain off. So that's certainly something that we keep an eye on. And then we also look at parasites sometimes in our ruminants. So these are some roundworms that we found in the pigs. Pretty easily treated. Sometimes they're fun friends to find. So as far as what I see every day, obviously I see a lot of ruminants, a lot of cattle, dairy cattle, beef cattle, some camelids, some alpacas and llamas. I do see some horses as well, some sheep and goats. This is from a horse. These are called gastrophilus. They start out as eggs. Usually they're laid kind of right around the horse's nose, maybe on lower legs. The horse will ingest them, just happens. And then these eggs will go down into the stomach. They'll hatch, and these larvae attach to the stomach. They don't cause any issues in the horse. A lot of times we'll just find them incidentally, meaning the horse died for some other reason, and we went in to try to figure out why it died, and we find these little friends in there along with whatever the horse actually died from. So they're usually a fun little finding if we find them.
So they're not harmful in any way?
Mm-mm. Nope, I believe it would be considered a symbiotic relationship. So the horse doesn't, well, maybe not necessarily symbiotic. I don't know if the horse benefits from it, but the horse isn't harmed from it in any way. So those are there for you guys to look at. Does anyone have any questions?